We're back on the path, hopefully lit in gold. Welcome back to Right Path to Retirement, the podcast hosted by Jimmy Lynn, president, founder, and financial advisor at Right Path Wealth Management. You can get in touch with Jimmy and the team, and they take a bunch of these calls every week at rightpathwm.com or by dialing 702-805-7000. They're in the Vegas area and thereabouts. Jimmy, how we feeling today? You doing well?
I'm doing great, Doug. Thank you.
I'm so glad to hear that. Doing okay myself here. I've been geared up, all plugged into NASCAR. My Atlanta Braves are in spring training, so this is like the time of year where sports gets all in gear, and hopefully things start warming up, though as we record here in February, it is quite chilly in the Atlanta area. Last episode, we kind of went all the way back to the drawing board, back to the very basics, which is what to bring on your first or second trip maybe to an advisor. All right, having your records in order. But Jimmy, I just want you to repeat again to these people, even if they just heard that last episode, if you don't have it all in order, that's okay. Disorder warrants a call to you, right?
Yeah, absolutely. Like in every one of these episodes, we're always emphasizing people, if you're entering that stage of retirement, you're within a couple of years of retiring, or if you've just got into retirement and you still haven't necessarily gotten your financial house in order, that's what we do every single day is we meet with people to talk about their situation and see if we can give some advice and kind of point you in the right direction. If you want any help from us, we're happy to talk about that, but that's not an obligation. Really, just the first step is coming into our office, scheduling that meeting. You can call us at 702-805-7000 to get us on our calendar for a complimentary consultation, but non-threatening environment, just talk about your situation. We do encourage you to bring some paperwork if you're comfortable with that, for us to kind of give you a prognosis of your situation. But yeah, take that first step if you're in that situation. And I would imagine if you're listening to this podcast right now, you are one of those individuals that may have specific questions. And so I encourage you to let us help you answer some of those.
That's 702-805-7000 or rightpathwm.com. Today, we're going to discuss a pretty big bomb that dropped in the healthcare industry very recently, a story I came across on marketwatch.com that says health insurance giant Humana is dropping 550,000 of its less profitable Medicare Advantage customers. That's about 10% of Humana's total, and they're just trying to shore up profits. Basically, these are the accounts that have the least return on them, because of the lower cost of Medicare Advantage. And other insurers, the article says, including CVS and Centene, are also looking at potentially doing something similar. This is right in the middle of the Medicare Advantage annual open enrollment period, so there's some time, Jimmy, for people to figure this out. But if you are of lower income and you're losing something like this quickly, you got to think on your toes and not drag feet. So what have you heard about this, and how do you help people steer through it, Jimmy?
Yeah, Doug, this is a great article, and it's really of no surprise to me. I'm pretty locked into the Medicare community. I actually have the AHIP certification, which is a requirement to be able to advise and sell people any type of Medicare Advantage plan. So it's actually a requirement for me on a year-to-year basis to be on top of what's going on with Medicare. I do that not because I love Medicare, Doug. It's because my client base are retirees, right? So they are the people that will be going on to Medicare very soon, if not on Medicare. So it's my job, just like any advisor who's going to help this community, you have to be on top of all of these topics. So with regards to that specific article, basically, if you kind of take a step back, Medicare Advantage, it's also known as Part C, right? So the alphabet soup of Medicare, there's Part A for hospital coverage, Part B for outpatient services like seeing a physician. Then there's Medicare Part C, which is Medicare Advantage. And that's what this article is talking about. Now, what people sometimes aren't aware of is when you sign up for Medicare Part C, essentially the government is no longer providing you with Medicare Part A and Part B. Now, the private healthcare company like a Humana, they are providing you with Medicare Part A and Part B. What happens is the government, whatever money they had allocated for you for Medicare Part A and B, whatever they had budgeted, they now give a portion of that directly to Humana, because Humana is now providing you those services through Medicare Part C. So it's kind of a web. But remember, Humana is a publicly traded company. So their goals, although their mission is to help people, their goals are also to be profitable. So it's kind of like you have two, I wouldn't say competing things, but there could be some conflict there as far as providing the right healthcare and still maintaining profitability. So what it sounds like in this article, what's happened and what's happening across the board is that the government's getting a little bit more strict on the payouts that they're giving to these Medicare Part C carriers. And these Part C carriers are like, well, look, we're in the business of making money. If we cannot be profitable providing these Medicare Part C policies to people, then what are they going to do? They're going to drop them. And that's what we're seeing across the board. And unfortunately, a lot of people that are under these plans are being impacted right with that.
So what did you say the government is getting more strict on with these private carriers of Medicare Part C plans?
Well, it seems to me that the Medicare Part C companies, they will bill the government for some of these services. And I think the government was basically no longer paying out as generously as they previously were. So the plans are to reduce the amount of payouts, which obviously affect the bottom lines of organizations like Humana and CVS. So they are now making the proactive decision from a business perspective to say, if we're not going to get paid, it no longer makes sense to have these plans available.
Yeah.
Unfortunately, there's a ton of beneficiaries that are relying on this. So now we kind of have to shift the conversation until like, what are their options, right? What can these people do?
Well, for sure. So what is that case? I mean, just from healthcare, just from Humana alone, 550,000 people. I know we're a country of about 400 million, but that is a ton of people. So that's 10% of Humana's overall customer base that are suddenly going to be health insurance free agents, so to speak. So what can they do there, Jimmy?
Well, there's a couple options, and the article actually pointed out one really, really beneficial options for them if they can afford it. So when you look at why people are on Medicare Advantage Part C, oftentimes, not all the time, but oftentimes they're on it because it's affordable. Because sometimes there is no premium for Medicare Part C, so you don't pay anything for it. And a lot of times they're actually, because Medicare Part B, there is a premium for. And a lot of times these carriers will actually refund part of that. So it actually reduces your Medicare Part B premiums as well. So that's why a lot of people are on it. Now, some of the disadvantages, and I don't want to paint it with a broad stroke, right? But some of the reasons why people may not want to be on a Medicare Advantage plan is because you're kind of under the control of that specific carrier, meaning that you have to work within a certain networks. Your primary physician has to be in that network. So if you have a doctor that you love, but then now you're on Medicare Advantage and your doctor is not in that network, you can't go to that doctor anymore. If you do, you're going to be paying higher fees for that. So you lose a little bit of control when you're in Medicare Advantage, but the benefit of that oftentimes is possibly no premium, possibly some reduction in your Part B premiums as well. Now, if that's your situation where you still have to make sure that you can afford this, you can jump to another Medicare Part C carrier. So that's what we mean by being in this open enrollment period that started from January of this year, ends at end of March. You're in the open enrollment period. So you can jump to another Medicare Part C carrier. We actually recommend that you always review your plans because you may have a physician that's in your network last year, but this upcoming year, they're no longer in your network. So you have to make sure you're actually working with an agent that is reviewing your plans on a yearly basis to make sure that that's the first thing you want to take a look at. But if you're being affected by the fact that you're losing your plan, that's also an opportunity for you to switch. But the one thing that I will say is that the listeners out there, if they're in a situation where maybe they just don't like the Medicare Part C plans because of what we talked about, being in those networks and having kind of the control taken away from you and the carriers managing your care, they actually have the opportunity to move to a Medicare supplemental plan or a Medigap plan. And so the key difference there is with Medigap plans, you are no longer on Medicare Advantage. You're not on that Part C. You now get your Medicare Part A and B through the government again. You don't need to get approvals to see doctors. That network doesn't exist anymore. So you don't need to get approval to see a specialist, for example. The difference, though, is that there is a premium for your Medigap or Medicare supplement. So generally speaking, I've seen it range anywhere between $125 to $175 per month. And as you get older, that amount increases. But you cannot just jump on a Medigap plan whenever you want. So when you turn 65, there's something called guarantee issue, which means no matter what your health conditions, you are able to get onto that Medigap plan.
Yeah.
Once that window ends, then you actually have to qualify via health questions. So if you have some type of underlying issue, the heart issue, cancer recently, or something of that nature, you actually can't get that Medigap plan. It's called guarantee issue. In this situation, where a carrier has dropped somebody from Medicare Advantage, this is a guarantee issue situation. So if there's someone on that Medicare Advantage plan, Humana has dropped them, and they have some underlying issues like heart disease or something of that, where they typically could not get onto a Medigap plan, this is that window of opportunity where, because of the specific situation, they actually qualify for that guarantee issue. So there could be a silver lining in all this for someone in that situation where they can switch to that. But, we've talked a lot about this, Doug, and part A, part B, part C. I think for most of these people out there listening, their heads are probably spinning. Because there's, what's covered, what's not, who's paying for what. So what I encourage anyone who's confused about this right now, and especially if this situation affects them, is give us a call. Like I said, I'm AHIP certified. I know about the situation. I can advise them through it. So call our office, 702-805-7000. Reach out and get that complimentary consultation. And we don't just talk about finances and retirement and taxes. We talk about anything that affects retirees, and healthcare is one of the key pillars of retirement. So reach out to us. We can advise you or point you in the right direction. So I definitely encourage anyone to reach out.
Especially someone that's certified like you. Again, 702-805-7000, rightpathwm.com, the two best ways to get in touch. I mean, Jimmy, you're right. My head's spinning hearing about it, and it doesn't even apply directly to me, right? I'm not on the Medicare deal, but when people are losing their insurance or seeing the parameters within their insurance, maybe you're on a different carrier and suddenly this costs more, that premium costs more, I'm getting less for the premium I'm paying. It's a great time to reassess it, just like you said, to do every open enrollment period and get in touch with someone like you who could give the bigger picture and help people know kind of what's connected to what. So thank you for sharing that.
Yeah, no, absolutely. Because I'm convinced that there's a government department somewhere out there whose main goal is to make things as confusing as possible. And their targets are things like Medicare, Social Security, and taxes. And unfortunately or fortunately, that's why our roles exist, in the community. So definitely encourage people to reach out so we can kind of fight that battle with them, with the government.
Would that be the Department of Government Inefficiency? Would that be what
that would be? Yeah. So it's not Doge, but it's Doggy. Yeah.
Doggy. And we won't go any further than that. Okay. So that's
right.
But DOGI. We're not saying that exists, but it just seems like maybe there's one somewhere, and like Silver Springs, Maryland, or something, somewhere just in some
possibly
office park. No, we don't know. But anyway, we definitely encourage you, if you have questions, again, to call Jimmy and the team, 702-805-7000 there in the Vegas area. And Jimmy, thank you so much for sharing this with us today and at least getting that conversation started. I know there's a lot more to talk about on the issue. We can really get in the weeds, but this at least gets the mental juices flowing there.
Yeah, for sure. Always a pleasure, Doug.
Pleasure is ours. Thanks to our producer, Daniel Salerson, for pouring through this and making sure we didn't mess anything up and then getting this thing published out there. And to all of you for listening, also be sure to check out the Right Path Wealth Management Facebook page, and there's a YouTube page that's being launched too. Go ahead and subscribe, even if you don't see content there yet, because Jimmy and the team are going to put out a lot more educational content, maybe even some shows of the podcast eventually, some episodes, and that just search Right Path to Retirement on YouTube or go to youtube.com/@Right Path to Retirement. He is Jimmy Lynn, president, founder, and financial advisor at Right Path Wealth Management. I'm Doug Turnbull, and we'll have another episode of the Right Path to Retirement podcast coming your way here soon.
Insurance products are offered through the insurance business Right Path Wealth Management. Right Path Wealth Management is also an investment advisory practice that offers products and services through Impact Partnership Wealth, LLC, IPW, a registered investment advisor. IPW does not offer insurance products. The insurance products offered by Right Path Wealth Management are not subject to investment advisor requirements. Investing involves risk, including the potential loss of principal. Any references to protection, safety, or lifetime income generally refer to fixed insurance products, never securities or investments. Insurance guarantees are backed by the financial strength and claims-paying abilities of the issuing carrier. This podcast is intended for informational purposes only. It is not intended to be used as the sole basis for financial decisions, nor should it be construed as advice designed to meet the particular needs of an individual situation. Right Path Wealth Management is not permitted to offer, and no statement made during this show shall constitute tax or legal advice. Our firm is not affiliated with or endorsed by the U.S. government or any governmental agency. The information and opinions contained herein provided by third parties have been obtained by sources believed to be reliable, but accuracy and completeness cannot be guaranteed by Right Path Wealth Management.